I'm going to be demonstrating how to give a sub-Q injection. So first, I'm going to check my order and compare it with my MOR. I'm going to check for allergies, and I'm going to perform hand hygiene. I'm going to state the sites that you can give a sub-Q injection, which is the upper back, the posterior arms, the abdomen, the upper anterior thighs, and the upper buttocks. So now I'm ready to go to my med room, and I'm going to gather my supplies. I'm going to perform hand hygiene. I'm going to have my insulin syringe, my cotton ball, my alcohol prep pad, and I'm going to have my MOR as well. So now I'm going to take my medicine and I'm going to check it 3 times. I'm going to check it for any contaminants, and I'm also going to check the expiration date. So I'm going to check this when I pull it out of the storage area, when I get ready to draw it up, and when I get ready to administer it as well. So I'm going to take my alcohol prep pad. I'm going to clean it off for 30 seconds. Let that dry. Take my insulin syringe. And since my MOR tells me that, well, my order tells me that I need 10 units of insulin, I'm going to pop the cap. And I'm going to draw back 10 units of air. Okay, so I'm going to push that air into my vial. And I'm going to draw up 10 units of the insulin. Okay, if I had any bubbles in here, I would just slowly dump it out until they were gone. And I'm going to use the scoops technique to pop the cap back on. Okay, and now I'm going to check this again. I'm going to put it back into my storage area. So now I'm going to get ready to go to my patient's room. I'm going to perform hand hygiene again. I'm going to introduce myself. I'm going to don clean gloves, and I'm going to check for allergies, and I'm going to have the patient state their name and date of birth, and I'm going to check it against their ID band. So I'm going to check to see when the last time they had their insulin and where it was given and what time. So since the last time they had it in their left abdomen, I'm going to give it to them in their right posterior arm today. So I'm going to position them into a comfortable position. I'm going to take my alcohol prep pad. I'm going to clean it for 30 seconds. Clean that area for 30 seconds. Okay, so I'm going to let that dry. I'm going to pop the cap. And I'll be going in at a 45 or 90-degree angle, depending on the patient's weight. So I'm going to press the skin, inject it, push it in, and then I'm going to put my needle into my sharps. So I'm going to apply slight pressure, clean that off, position the patient into a comfortable position, bed low and locked, and I'm going to wash my hands. Then I'm going to go and document, and then I'm going to come back 30 minutes later to check on them.